Hey YouTube friends, today is Tuesday morning and I'm not at work only because I gotta go to the hospital, which I am right now. Let's see, I can turn it around. I have a PET scan today, just in a little bit. So what happened is right around Christmas time last year, I noticed I had a little bit of a lump by my right chest wall. So January rolled around, February rolled around, I noticed it was getting bigger. So I went to my doctor. They ordered a ultrasound, and then they looked at it, and my doctor said, with my history of cancer, I need to go see my oncologist. Well, my regular oncologist is not at the hospital anymore. He moved out of state. So now I went to another oncologist, and she's really nice. And she said that I should get a PET scan. So right here, my right chest wall, I'm not going to kind of outline it right here. They say it's about the size of a lemon. They checked my neck. They checked my armpits, my groin. They didn't find any other like lumps or anything like that. So maybe this is just isolated. It doesn't really hurt, kind of like a bruise. So yeah, I'm going to do this PET scan, and then they'll go from there. They said that the doctor said if it's just right here and nowhere else, then they can do a low dose radiation on this. They said, I don't know, like 2-day thing. So, but if I have other, things that are hidden that they don't, that's why the PET scan is going to be done. Then I'll probably have to do my Rituxan that I did 2 years ago. I feel great. My numbers, my oncologist was like amazed that my numbers came back so well, normal. Even my white cell count came back. So they're like, they don't know, if cancer or something like that, then my stuff would be down. But my doctor thought it was a fatty cyst, but my oncologist, because she said this is so hard, she thinks it might be cancer. So that's what I'm going to do, the PET scan. So let's go do it. All right, I got my dose of medicine, you want to call it that. Just got to wait for a little bit. Then I go into the tunnel to get my scan. All right, all done with the scan. It's like 12:40. My scan was supposed to be at 9:30, which I was here by then. But what happened is the dose that they put into you, or to me, they were having problems with computerized. So it was like about an hour and a half delay. And then when they put the medication in you, well, actually, no, it was actually 2 hours. That's right, 2 hours. When they put the medication in you, or nuclear stuff, whatever, to make your stuff highlight, that they said something, I don't know, there was an IT problem, computer problem, or whatever, and that's why it took so long. So then after that, I had to wait an hour so it could go through my body, and then I did the scan. So scan went well, and I will have to wait to what the doctor says, and then to go from there, what kind of treatment I need, or if that is a big cancer tumor there, or what. So again, I feel great, and yeah, even got a souvenir, my wristband. Okay, where is it? Right there. So, yeah. All right. I will get back when I have more updates on my results. Thanks for watching. Hey, YouTube friends. I wanted to update you on my health. I'm going to be, I don't know what you want to say, but I have a video that's going to be coming out that's going to explain a little bit more. But I thought I'd give you an update. So I'm just in my vehicle. I'm not driving or nothing like that. And I took my glasses off because it's just easier for me to see the camera looking at you guys. So today's Thursday. Tuesday, I did a what they call a lumbar puncture, or back in the day, call it spinal tap. I know since I was diagnosed with the cancer like 12 years ago, I know they wanted to talk about doing it, but they felt like they didn't need it. So, but now this doctor wanted me to do it, and I was not happy with it. But anyway, I decided to go through with it, and it wasn't that bad. I mean, they froze the back area. It wasn't too bad. I've had sometimes IVs put into me that were a lot worse. And then once they freeze it, she had to play around for about 10 minutes to get where she needed to be. And the only thing I felt was pressure. It was almost like someone was punching me in the side of the kidneys. But anyway, if anybody's had that done, you know what I'm talking about. So, they drew out 2 vials of fluid, and it was clear, so that was a good thing. I did see on the internet my results, but I haven't talked to the doctor yet. So, but they did say that there was no cancer in my spinal area. And then they do this, so it's not just, that there is there, but they put a little bit of chemo in my back after they drew, and then they just to prevent anything from happening, or if in case, just trying to be proactive about it. So actually I was able to go back to work with that. It was a little stiff, a little sore, but actually, it wasn't as bad as I thought it would be. Would I do it again? Absolutely. Now I know what I'm looking for, what to expect. The only one thing that happened during my time in there, and then the nurse asked me, they wanted to ask me, there's going to be some students in there because they want to learn. And I said, oh, absolutely, let them go in there. That's how they're going to learn, I don't mind them, it's nothing to hide or nothing like that. Well, when they were poking and prodding me and stuff like that to get where they needed to be, and they did, and I'm not in no way, shape, or form making fun of this person, but this person, I don't know, I think this was a little bit too much for her, and she had to sit down and catch her breath. I think she was about ready to pass out. Now, that happened to me about 15 years ago. No? Maybe 20 years ago. 20 years ago? Yeah, my wife cut her finger, and she needed some stitches, so I took her to the emergency room. Now, I was in the birthing room with both our kids and never had a problem. I've cleaned fish, all sorts of animals, never had a problem. Well, they were stitching up my wife's finger, and I was standing in the not operating room, but the emergency room, and she was laying on the bed. And the doctor that was doing the stitching looked up at me and he said, "Sir, are you feeling okay?" And I said, "Yeah, why?" He goes, "No, you're not. You're pale as a ghost. You better," and then he instructed the couple nurses that were in there to have me lay down before I would pass out. And I felt fine. I was, So like I said, I'm not making, saying anything bad about this person. It does happen. You don't know it. I didn't know it. So now whenever there's like a needle involved, I don't even look at it, because I know if I do look at it, I'm probably gonna just pass out or something like that, and then you got more problems. So whenever they draw blood from me or whatever, I just kind of look. So yeah, the lumbar puncture went relatively well. It was just a little uncomfortable. And like I said, I was able to work, no problem. Um, Yesterday was, the day after, and my back was a little bit sore, as expected. But I made it through the day. I didn't, I went to work and stuff. Today feels better, a lot better. But yeah, so I just wanted to give you a quick update on my, what I had done, lumbar puncture, aka spinal tap. So, yeah, and I'm going to have some more videos about my health and other things that I like to enjoy and that I'm going to enjoy. So, I feel good, and you guys take care. Subscribe to my channel, and I'll have more videos coming out. See you real soon. Thanks for watching.